Good morning. My name is Deborah Small. I'm the Executive Director of Break the Chains, Communities of Color and the War on Drugs, and I'm talking today about the topic of reversing the epidemic of incarceration. There are three main points that I'd like to make. One is that the incarceration epidemic that we've been dealing with for the last 30 years has less to do with crime control than it does with people control. I think the first panel that talked about incarceration and social control did a really good job of making this point. What I wanted to add to it, though, is that we have a national narrative that says that the increase in incarceration was directly related or a response to increase in crime. I say that it was actually a response to the urban rebellions of the 1960s and the increased demand by African Americans and other marginalized communities for economic equality and opportunity. And that instead of responding to those demands, as was outlined by the Kerner Commission report in 1968, that the political response was to become more punitive and to enact laws that would criminalize people and thereby neutralize that rebellion. Incarceration has been one of the many ways in which we've been managing the population of unemployed black men and reducing their ability to compete with whites in an ever-tightening job market. So again, to me, it's not a coincidence that you saw the increase of incarceration that coincided with the loss of blue-collar and working-class jobs in many urban communities. The second point that I want to make is that reducing the epidemic or reversing the epidemic of incarceration is going to require shifting the relationship to punishment in African American communities. I believe after 15 years of doing criminal justice work in communities of color that one of the biggest obstacles to success is the acceptance by African American communities of the punishment paradigm, of actually believing that punishment is an appropriate way of changing people's behavior. And I think that we've lost the distinction between punishment and discipline, and also the sense of proportionality and a recognition of the fact that punishment actually doesn't teach anyone what it is that we want them to do. All it does is teach what not to do or what not to get caught doing. And more specifically, having over 100 years of black people being subjected to severe and disproportionate punishment for relatively minor offenses has reinforced the belief that black life doesn't have much value. And that's something that's reflected not just in the criminal justice system, but by the way in which people deal with each other every day on the street within poor communities. And so, in my view, shifting that relationship, shifting that paradigm is an important part of reversing the epidemic of incarceration. And then the third and final point that I want to make is that more important than either of the two things that I just talked about is the need of white people to actually begin to acknowledge that so much of what happens around incarceration has less to do with the behavior of the people who are put behind bars than it does with the need of the greater society to punish. I think that the need of the white society to target and punish blacks is something that has been with us since the very beginning of the Republic, since black people were first brought here. And it's very easy to talk about changing the behavior of people who've been labeled criminals, but not to focus on who's doing the labeling and why. As a person who spent the first part of my professional career working as a private attorney on Wall Street, I can tell you that I saw a lot more harmful behavior to society that occurred in corporate offices that skirted legality and never got punished than any of the things that I saw happening on the street. But for me, one of the things that I wanted to impress upon people in this particular environment, that I think that it's important for us to begin to recognize that racism and white privilege is in fact a form of mental health disorder that is suffered by pretty much the entire population, and that we actually really need to begin addressing it that way, because it generates projection of people's fears and anxieties onto other populations, a distortion of the truth and reality. It leads to delusional behavior and real denial, as we have seen evidence in many of the comments by people who still hold on to racist beliefs. But for me, more important than the need to address white privilege from the perspective of improving race relations, I think it's essential for the health of America for us to actually examine the narrative that we have about ourselves racially. The belief that this was a white country actually flies in the face of reality. This was never a white country. We just preferred to pretend that the other people of color who were here when Europeans first came were not really here. The narrative that says that we are a country that was built on freedom is also not true. So I think that if we want to be able to meet the challenges of the 21st century in a global community, we have to really be willing to examine these narratives, because the countries that we have to deal with, the ones that are rising, they are actually filled with people who have the memories and the history of having been victims of imperialism and colonialism by the Anglo-American Empire. And they're not willing to accept our narrative of our own moral and political superiority. So if we're not willing and able to actually change that and deal with the world on its own grounds in a space of truth, then I think that we're going to find ourselves continuing to see a decline in our economic and political strength and our ability to be cohesive as a nation at home. So again, the three things that I think we need to do to reverse the epidemic of incarceration is shift the relationship of the black community to punishment, recognize that incarceration has more to do with economic control than crime control, and three, address the continuing mental health disorder of white privilege. Thank you.